I'd like to thank the Academy and all the people that helped me earn this incredible award. This kind of a survey of how we were doing in our practice is important for us to get and receive and celebrate. I want to talk a little bit about surveying, about how we gather information from our patients and maybe even from our team as to how we're doing. The reason we want to do this is a best practices concept. What are we doing well? What can we improve on? And what should we stop doing and maybe even outsource? This becomes really important when we think about a dental practice, because patients who are really satisfied, really loyal, and very engaged with the practice, they do one thing that's very important to practice growth today. They refer their friends. There's a very interesting metric that you can use in a survey where you ask 3 or 5 or 8, maybe 10 questions, never more than 1 page. If you use SurveyMonkey or something like that, never make it too long and too difficult of a survey. But somewhere in the middle, not the first or the last question, ask a question that's referred to as the Net Promoter Score question. How likely are you to refer a friend or a colleague to our practice? 0 to 10. In fact, it's a great scoring mechanism, just like we do for muscular pain when we're doing examinations. It's a great scoring mechanism for how engaged the patient is with the answer to that question, that we always run on time, that our dentistry is a good value, that our team is friendly and attentive, whatever the questions are you want to use in your survey to work on. But the Net Promoter Score must have a 0 to 10 scoring. And here's how you keep track. 9s and 10s, totally engaged. Those people are promoters and likely to refer their friends to your practice. 0 to 6, oops, something's wrong. I don't know what it is. We could delve into that deeper, but something's wrong in the relationship. They're actually not a promoter. They're not even neutral like a 7 or 8 would be. They're a detractor. It's negative. And then the 7s and 8s, because they won't commit to the promotion side or they won't commit to the detractor side, we call them neutrals. So if you surveyed 100 people and you got 40 promoters, 10 detractors, and the rest were neutrals, we would say your Net Promoter Score is the 40% that were promoters minus the 10% that were detractors. Your Net Promoter Score would be 30. What does that mean? Is 30 good or is 30 bad? 30 is 30. It's where you're starting. If your number is 60 or 70 or more, just take your team out and celebrate how wonderful you're doing in terms of promoting yourselves in your practice and how engaged your patients are. And if it's less, try to think of some things you can do to improve that score, and then go back in a few months and test it with another random sampling with some other questions. The Net Promoter Score is the single greatest predictor of practice and business growth, profitability, and referral of new customers. And that is the lifeblood of your practice. You would want to know that metric. How referable and relatable and engaged are your patients?